Welcome to the Voices of the Collective. I'm here again, your host, Kristina Scaglione, owner and founder of Limitless Integrative Wellness. I brought back another really popular guest, Dr. Zena Joseph. Welcome.
Thank you for having me again.
Yes, I popped into her office and I asked her if she would be willing to come on and speak about this, but I wanted to talk about the GLP-1 craze and some other items that are, in the umbrella of preventive care. I think it would be a good thing for us to kind of go over today.
Ask away, Kristina.
Yes, I'm going to. Tell our listeners your company name and, what you do here at Limitless.
So I'm Dr. Zena Joseph. I'm a family medicine trained doctor. My company is Safe Harbor Medical, PLLC, and I'm a DPC, which is a direct primary care group. And basically, I provide all sorts of family care. I do a lot of preventive medicine. And I charge a monthly membership fee, and that's about it. So you get good care for a decent price, and I'm here in Port Jefferson.
And I love having her here. We have a lot of fun in the office.
I'm not paying her to say that.
She is. All right, so we're going to start at the beginning.
Yes.
So we'll just start with what is a GLP-1 medication and how do they actually work in the body?
Okay, so when we talk about GLP-1s, we're talking about glucagon-like peptide 1s. That's what it's called.
Glucagon-like
Peptide
1.
Yes.
Okay.
So in that umbrella, we also include GICs. GICs are, I'm going to read it out because I don't want to mess it up. They're glucose-dependent insulinotropic polypeptides. So your GLP-1s are basically peptide hormones. So what are peptides? They're just small sequences of amino acids. That's all they are. Your body produces them naturally as well. So when we're talking about GLP-1s in the medical field, we're talking about the synthetic ones that we're prescribing. So that's going to be your semaglutide, which is a true GLP-1, and then you have tirzepatide, which is a GLP-1 combined with that GIP. So those are kind of your two classes that we're going to be talking about today.
Okay. All right. And how do they work in the body when you take a synthetic one?
So they do a few things. Number one, they do slow the intestine down. Okay. This is a hormone that's created by the intestine, released by the intestine. So they slow the gut down. So you tend to feel fuller, longer. They also send a message to the hypothalamus, which kind of controls satiety. So satiety means the feeling of fullness after you eat. Yeah.
So that's why people complain about constipation? Is that part of?
So constipation is hand in hand with that slow GI motility. So that's why that happens. That's one of the most common side effects.
Well, I mean, that makes sense.
Yeah. It also, GLP-1s also stimulate the pancreas to release more insulin. So you need that to kind of, synthesize sugar and break it down, metabolize it. And then they also help to prevent the release of a hormone called glucagon. So glucagon is what converts glycogen to glucose. You don't want that conversion because you don't want glucose just kind of hanging around. So it stops the release or slows down the release of that hormone from the liver itself. So GLP-1s actually do a whole bunch of things to the body.
Wow.
Yeah.
Now, Ozempic has become kind of a household name. How did we get here? And why has this become such a cultural phenomenon?
So the class of GLP-1s have actually been around for quite a long time. We've been using them since 2005. We used to use Byetta was very popular back in the day. Those were generally for your diabetics. So we were using these meds for diabetics to control the blood sugar, as I mentioned, with regards to its effect on the pancreas and also preventing, again, that conversion of glycogen to glucose. We've been using it for about 20 years, but one of the things that we found in these diabetic patients is that they lost weight, right? That was one of the side effects. So people kind of clued in, the pharmaceutical companies clued in and said, oh, this may be a game changer for the weight loss industry. Well, the reason why they have exploded is because they are so effective. I think everybody remembers, well, at least of a certain age, remembers phentermine, right? The phentermine craze, everybody was into phentermine. Phentermine's still around, but with phentermine, you would get maybe 5 to 10% of weight loss with that one, which is nothing to sneeze at, but it's modest. With the GLP-1s combined with the GICs, you can see about 15 to 20% of weight loss, which is a lot. It's just the effectiveness of it has really jump-started and made it a huge craze. So
okay, all right, that makes sense. What is the biggest misconception that you hear patients tell you about Ozempic, Wegovy, or other GLP-1 medications?
So I think the biggest misconception is that it's a miracle drug, that it's an easy way out.
Right.
That's the biggest misconception. And I want to make it very clear The GLP-1s, the GICs, they're just a tool in our armamentarium for weight loss, okay? So I can give you that. I prescribe them all the time. But if you're not doing other things, you're not going to have sustainable weight loss, and
I
you
think that
will
makes
have
sense.
side effects.
That makes
Yeah.
sense. I think with any craze,
Mm.
you need to do other things. But I think
Yes.
you had said, not to derail our questions, but you had said something to me recently about how if you're on a GLP-1, it's important for your bone health to weight lift. Do you
Right.
want to tell people why?
Yes. So weightlifting is something I preach all the time, regardless of not or if you're on GLP-1s or not.
Shout out to Regina,
Yes, to Regina.
REM Fitness.
The reason why weight training is so important is when you are losing weight off the GLP-1s, initially what you are losing really is muscle. You lose muscle mass because you're just not eating enough protein, okay? Unless you're making a conscious decision, you're just not hungry.
So then your body eats your body.
Well, if you're not if you're losing muscle mass, really the density of the bone starts to get compromised. And how do we build bone density? By weight bearing. Okay, so this is very important, especially to women who are perimenopausal, postmenopausal. You want to keep that structural integrity of the bone so that you don't get a hip fracture
Right.
or a broken bone later in life. It's a lot easier to prevent it than to treat those things. So you have to have protein in order to build muscle, but then you have to weight train to actually build the muscle.
Right.
So that's very important. Yeah.
Okay. So who would be a good candidate for this medication and who would not be?
So diabetics are really the ones that are the group that this class of medication was targeted towards. So definitely your type 2 diabetics, that's really what these meds are geared towards. However, they've been doing all sorts of studies on these meds. And what we found is that patients who have sleep apnea, for example, they're good candidates for some of these medications. Patients who have a history of cardiac disease or coronary artery disease or cardiovascular disease, I should say, they
Okay.
are great candidates for this. People with kidney disease are a great candidate for it. Congestive heart failure. There's all sorts of indications now that are coming through our research, and it's really expanded the scope.
Okay.
So,
And who's not a good candidate?
who's not a good candidate? So, if you have a history of certain neuroendocrine cancers, that's not you're not a good candidate for it. So, again, speak to your doctor about that. And we also don't give it to patients. We tend to not give it to patients with a history of pancreatitis because there is some evidence that it could increase that risk.
Okay.
Yeah, it's kind of limited. Most patients are, you know, you can pretty much give it to.
With that being said, though, do you feel that you have seen a lot of people who really weren't meant to be on this medication taking it?
That's an interesting question. There are patients who are not overweight, not obese, non-diabetic, don't have cardiovascular issues, who are taking it. Maybe they're taking a compounded dose or whatever. I think it speaks to a deeper problem, a psychological problem. So we can talk about body dysmorphia, we can talk about depression, those types of things, disordered eating, and so forth. So, there are some people who are misusing it for that reason. I just want to be very clear that this is a medication. It has side effects, serious side effects. So you really need to speak to your doctor about whether or not this is the right medication for you.
Okay. Something else I've heard people say, and this is not just with GLP-1s, but I would say with any craze or any sort of fad, and I feel like this is kind of in that fad realm at this point with the amount of people that we've seen using it. Are there patients that ask you, like, do I have to be on this forever? Will all the weight come back when I stop using them? What's that transition like?
So it goes back to how we view obesity. So obesity, I want to make it very clear, is a chronic disease. We need to treat it that way. So if you're talking to me about whether or not I have to stay on this forever, the short answer is yes, if you want to maintain, that weight loss. You wouldn't ask a diabetic whether or not, hey, are you ready to come off of your insulin? You don't say that. You got to shift your focus a little bit and how you view it. So the short answer is yes. If you do stop the medication, the weight does tend to come back because the food noise comes back. So do you have to stay on the same dose? Of course not. We can always talk about maintenance doses and so forth, but the short answer is you do have to stay on them.
What are the long-term side effects of that?
So the long-term side effects of that, so there is some data, again, that we spoke about in terms of bone density that can go down. There is, the main side effects, of course, are GI issues. So constipation, diarrhea, nausea, vomiting, those are very, very common. I have had some patients who have developed gallstones from that. And if your gut is not moving, so if you have poor gut motility, there is a chance it could just stop moving. And then you have something called dead gut, where there's no blood flow, nothing's moving, everything is obstructed. And that's kind of a medical emergency. Is it common? No, it's not that common. But this is why things need to be kept moving in the gut so that that risk doesn't is mitigated.
Okay, based on what you're saying, if you maintained a healthy lifestyle, if you maintained a healthy workout routine, if you maybe even received counseling for any of those drop-down menu options that you mentioned before, body dysmorphia, disordered eating, what was the other one? Depression. So if you were being treated for these things and you had any other comorbidities that were happening at the same time that you're trying to deploy healthier methods, then your risks reduce
Yes.
for long-term use?
Yes, they do. Yeah. But you have to keep up with it. So we talk frequently about personal accountability here at Limitless. And that's
Like, where do we talk about that?
Yeah.
We talk about it at Limitless. Got it. Yeah.
So that personal accountability, I really do feel is an important part of this. You are responsible for your own health. If you don't want to have to deal with the, majority of those side effects, you got to do these other things. It's a
that makes sense.
whole thing. It's not just about weight loss. I want to make it very clear.
And do you view that GLP-1s have a place in overall long-term wellness in the industry?
I do. I feel like I've seen it in my own practice. I've been able to get patients off certain medications because we have put them on these GLP-1s. It also kind of kickstarts sometimes like a whole movement. So, for example, when patients start to see the pounds kind of fall off, they're more motivated to actually keep going to the gym, drink the water, eat healthier because they're seeing results in real time. So that's a good thing. That's something that we really don't talk about a lot. But yeah, it's why not?
Yeah.
It's great.
I mean, yes, I've seen improvements with mental health as well because there is a motivation that suddenly sparks when you see change.
Correct.
So that makes a lot of sense. As a physician focused on prevention,
Mm-hmm.
what role does preventive medicine play in reducing chronic illness and improving quality of life?
So I am obviously biased because I'm a family medicine doctor. So we always say an ounce of prevention is worth a pound of cures. If I can prevent certain things from happening in the first place, you save a lot, not just in terms of your time and your health, but also money, right? Like this is a huge cost savings if you can prevent something from happening in the first place. So again, this is not new information. It's all common sense, proper diet, exercise, movement, socialization, not smoking, not drinking, proper sleep. That's my biggest one now.
Sleep hygiene.
Sleep hygiene. All of these things together, if you can put it together in a very cohesive, compatible way, they're going to prevent you or at least delay certain diseases, diabetes, high blood pressure, depression, all those kinds of things. I can't emphasize how much of this is preventable. um, just looking at it from a cost perspective.
Well, I mean, that leads me right into my next question. Why do you think people wait until they're already struggling before they get help?
So for a lot of patients, especially in the United States, it's just
So it's got to go there, Miss
Yes,
Canada.
I have to take it as a Canadian. I have to take it there. But the U.S. doesn't really put as much into preventive medicine as other countries do. So I'll give you a small example of this. So after age 40, all women are supposed to get a mammogram, right? So I go and I get my mammogram, and the mammogram is covered. But then I usually get a report back saying that, oh, you have dense breast tissue, so you need to get a breast ultrasound. So the breast ultrasound is not covered. That I have to pay for. That is $300. Now, I am someone who is a physician who is comfortable, with regards to, how much money I'm making and so forth. And the imaging center is very close to my house. So I have no reason to not go and get an ultrasound. But there's still something in the back of my brain that's like, oh, why do I have to pay for the ultrasound? So if someone like me is saying that the average person is not going to be motivated to do all these other things and have to pay for it, especially when they already have insurance. So I think that's one of the biggest hurdles with the American system. We just can't, a lot of patients just can't afford it. So, but you will pay for it later.
Yeah, so it's like 6 to 1, half a dozen to the other. When do you want to pay for it?
When do you want to pay for it? So, that's.
No, but it makes it, there's a tangible example that you gave as far as barriers that we have in place that is just part of the culture here, in addition to the barriers that we put on ourselves.
Yeah, people are also stressed out all the time. They're working multiple jobs. They have kids. They have responsibility. When do they have the time to, quote unquote, get to the gym, to go to the farmer's market, to buy organic? There's a lot of thinking that is involved in this. It's not just something that comes to you like, oh, maybe I should just work on diet and exercise today. You have to plan it in this country.
Yeah. Yeah. And you already mentioned one of the things that I would imagine you would include in this next question's answer. But what are some of the labs and preventative screenings that people should be aware of that they could be doing that are covered most of the time that would help them avoid future problems?
So if anyone's going to go get an annual physical, your complete blood count, which we'll, talk about, focus on your whether or not you're anemic. It'll talk about your platelets, your white blood cell count. That is covered. Your complete metabolic panel is covered. Your metabolic panel will check your liver function, your kidney function, also your electrolytes. Cholesterol is usually covered, so a lipid panel is covered. Those are the three things that are usually covered in terms of blood work. And A1C is a little bit controversial. Sometimes the insurance companies will not cover that unless the glucose test that's part of the CMP, the complete metabolic panel, is elevated. Then they may cover it. We can talk about a thyroid test. That's not considered routine blood work, but if you are having issues with, abnormal weight gain, hair loss, fatigue, that can sometimes be used to help cover that. So I'm a big fan of that. A lot of the preventive tests are age dependent. So, mammogram at 40. Nowadays, we recommend a colonoscopy at 45 just because we've seen the incidence of colon cancer increase at younger ages, which is very scary. And then, also we are talking about vaccinations, immunizations. There isn't a lot when you're an adult, but certainly a flu shot every year. After age 50, we can talk about a shingles vaccine, which is very important as someone who has had shingles. So
I got shingles when I was 8.
I was 3.
Oh my God,
Yeah,
girl.
yeah, you don't see it that.
No, you don't see it that young.
usually.
Yeah, I had chickenpox when I was 3 months old, and then shingles when everybody else was getting chickenpox.
You were getting shingles.
Yeah.
So my mom was pregnant with me when she had chickenpox. So
Thanks,
passed
Mom.
the vaccine because they didn't have any vaccines in those days, or not those vaccines. So anyway, so that's a good starting point. If we're talking specifically about GLP-1s, I would throw out there, this may be a bit controversial, I would throw out getting ultrasound of the liver just because there is an indication for certain GLP-1s if you have a history of non-alcoholic steatohepatitis. We call it NASH. So if you have a fatty liver, basically a certain type of fatty liver, you can sometimes get that covered with that diagnosis. So
Okay.
yeah, something to think about.
That is something I've never heard of.
Yeah. Oh, and a sleep study.
Why?
So there is a lot of data stating that GLP-1s have really decreased the incidence of sleep apnea in patients. And sleep apnea is not just snoring, okay? Sleep apnea is when you actively stop breathing at night. So
Do you have to be overweight for that?
not necessarily. Not necessarily. So another reason to get the sleep study. Also, sleep is very, very important. We're seeing new data in regards to its effect on high blood pressure, on depression, overall health. There's a ton of data coming out right now on the importance of sleep. And it makes sense because that's when you heal is when you're sleeping.
What do you wish more patients knew about preventive care?
It's doable.
Okay.
You just have to plan it. It has to be structured. It has to be part of your life. I don't like the word diet. I don't, it's not a diet, it's a lifestyle, but it's definitely doable and small changes can make a huge difference. We talked about weight training. Again, when I'm saying weight training, it's not every single day, an hour at the gym.
And it also could just be something light at home. Like you're
Yes.
saying, like 5-pound dumbbells
Yes.
or pick up a fat cat if you have one.
up a
A
fat cat.
fat pet. You have an overweight. I have a couple of those. You can use
Yes.
them at my house.
Yes. Ankle weights. You can put on some ankle weights when you're walking around the house.
Shout out Jane Fonda.
Yeah, but that is considered a weight-bearing exercise. So
Yes.
you don't even have to think about it.
Yeah, you're right. You're right. My
Yeah.
sister and I joke when my mom comes up to visit, she's always doing calisthenics in the background of whatever we're doing. Like we could just be waiting online for something at a coffee shop and she's doing squats on the line.
Yeah, it keeps it moving.
She keeps it moving. Yeah.
Yeah, why not?
Calisthenics. She's doing, what does she call it? It's low impact.
Low impact. Okay, so not high intensity.
Yeah. Low
Yeah,
impact.
it
Well, she's
counts.
also almost 80. So there she goes. She's still mobile.
Well, that's what you want. You don't want to be in your 80s and 90s, unable to walk, unable to,
Exactly.
wipe your own
My-
behind. Like you want to be able to do all those things. You want to be functional. So
Yeah. My parents are in their late 70s. They're living independently. They have all of their natural teeth, which is like rare
Same.
to say.
Yes.
Same.
And it's not
Same.
that I have all
Yeah, same. But in that age bracket,
Mhm.
it's not common.
Correct.
And there's just so many things that I think younger, healthier people take for granted, I think,
Yes.
in their youth.
Yes, they do. Yeah, it's the work that you put in now that's going to help you 20, 30 years in the future. That's what I'm a huge fan of, prevention.
You've built a practice around concierge-like direct primary care model. How does that differ from the traditional healthcare, and why does that even matter?
So in my case, direct primary care really focuses on the patient. There is no middleman or middlewoman in a sense. It's just me and you. There's no nurse, there's no health insurance company, there's no MA, there's no secretary. It's just me and the patient. It's a very, very natural, transparent interaction relationship. Okay. It's kind of a throwback to old school medicine. So because of that, I can afford to keep my patient panel kind of small. So instead of having the 2,500 patients I used to have in my panel, I can kind of whittle that down to less than 200. For the patient, this means that we get more time together. So we can have an hour together. We can correspond via email. We can talk on the phone. There is a lot of flexibility within this model. We would still use your insurance if you want to, if you have it for lab imaging, medications, that's all fine. I can help you with that. We just take the insurance payer out of the question with regards to reimbursement to me. And I think it's a great investment in your health. You have someone on your team who's really advocating for you and who can guide you. And if you have questions and I don't know the answers to, I have the time to actually do some research and find out what you
Right.
need.
And she has a collaborative team under the same roof that she can also, ask questions from some of us that are here that specialize in other niches that I would consider out of your scope.
Correct. So if I need someone who, even today, I had a patient who really needs, psychological care. So I have Kristina, I have April Lee. If someone is interested in weight training, they don't know where to start. We have Regina.
Hmm.
We have a massage therapist with Tara. So we have options. It's very easy to kind of curbside one of you guys and say, "Hey,
Yeah, w-
this patient."
that's true. Where do you see medicine going from now to 5 to 10 years from now?
I really feel like DPC, direct primary care, is going to explode. I think people are very frustrated with the healthcare system right now. They don't want to wait 2 weeks to go see their primary
Or longer. It's longer.
or longer for a physical. They're done with that, and they're tired of paying all these premiums, which are going to go up, by the way, and getting substandard care. So I think at least for primary care, you will see more doctors like me kind of exploding throughout the country.
That's great to know. I'm glad you're here.
Yeah. So if you want to get ahead of the curve, please join me. So
I have a couple of, they're not random, they're part of the conversation, but they're a little bit more of like micro focused. What do people get wrong about obesity?
they think it's laziness. They think it's a lack of willpower. It's none of those things. It's a chronic disease and it's multifactorial, right? It's not just, oh, you eat this or you don't eat this. Our whole world right now is very different from when it was even just 1 or 2 generations ago. So even the food we get, it's highly processed. We don't walk anywhere. We drive everywhere. Uh, People get that wrong. People are very, very hard on people, and especially women who are going through perimenopause or menopause. Hormonally, it's harder to lose weight as you
Yeah,
get older. You could be
absolutely.
eating the same thing. You could be even eating less. You could be working out, and you see, the deposition of fat, and usually around this central
We call
area.
that the spare tire.
The spare tire, your muffin top, whatever you want to call it.
Muffin
It's
top,
all
that's a good
normal.
one.
It's all normal.
Throwback.
Throwback, yes. So, I want to make it very clear that, we don't judge people when it comes to obesity. That is a chronic disease, and we have tools in our armamentarium to fight it. So,
Do you think GLP-1s are changing the landscape of responsibility and willpower?
I do think so. Just going back to people feel more motivated to start going to the gym, to drink more water, to choose healthier options because they do see the weight coming off. A lot of patients also anecdotally have stated that their joint pain has kind of alleviated.
Inflammation has alleviated.
Easily.
What's the lethargy?
Yes, yes, all those things. So you'll see within the next year or two some more data coming out regarding those specific things. But all around, I think they've made a big difference. And I'm not paid by, Lilly or any of these companies. I just want to say this is just based on the data that's out there.
Do these medications change your clinical approach?
They have. So initially, I would always have the conversation first about diet, exercise,
Yeah.
before maybe talking about GLP-1s. Now I consider it in the initial conversation. Not that we're going to jump immediately into doing it, into prescribing it, but it is a tool, and we're going to talk honestly about all the tools that we have available in order to help you achieve that goal.
What is the conversation people aren't having about GLP-1s?
I don't think some people are honest about the side effects. I mentioned GI side effects. Those are real. Most patients will complain of nausea.
Or diarrhea.
Or constipation. Again,
yeah, there's the opposite too.
It can go either way. So, that's why the diet does matter quite a bit. I've had some patients who, they were doing great on the GLP-1 and then they slipped and they started eating fattier foods and so forth. And they had real major issues with gallstone formation as well as severe diarrhea. So it's not just, take another pill like a Zofran to deal with the nausea. It has to be an all-around approach to it. So
yeah, exactly. And that's precisely what Limitless represents, is a multifaceted approach to any issue, not just health and wellness, any issue.
Or how you look. Like it's not about just how you look. That is important. You should like how you look, but it is, I'm kind of trying to cover all your bases here.
Absolutely. What is one thing that social media gets completely wrong about Ozempic and Wegovy and others like it?
What I don't like about social media is how all these websites have popped up where they say, oh, you can get this for, a discounted price and so forth. A lot of those things that you're seeing are compounded GLP-1s.
Which work differently?
So compounded GLP-1s, usually the medication is the same. The base medication is the same. Usually it's semaglutide or tirzepatide that they're giving, but the compounded pharmacy will add something extra to it. So in most cases, it's vitamin B6 that they will add. So we just don't have the data, okay? I can't tell you whether or not they work because I don't have studies to tell you whether or not they work. So I'm not going to recommend something if I don't have data behind it. That's just me. So yeah. And it's not a quick
to be
fix.
continued. We were basically studying it now. So in 10 years, we'll have more data.
Hopefully before that. But yeah, so, and also those online companies, they're not giving you the information regarding working out, protein intake, your mental health. Like this is, again,
so much. There's so much goes into this.
So much that goes in.
So if listeners could take away just one thing from today's conversation, what's one action they can take to improve their long-term health?
I've said this before and I'll say it again. Weight training. Okay. So everybody should be weight training.
REM Fitness, Wisconsin. If you're in New York, you gotta go.
You gotta go.
Or any other local gym.
I've done it all. Yes, they are all great. Just keep that body moving and push yourself.
You can also walk. If all you can do is walk, then walk at night, walk during your lunch.
Yes. Eat your lunch or eat your dinner and then go for a walk. The weather is beautiful right now. There's no reason to not take, 15 minutes to go walk. That will also do incredible things for your body and your glucose levels. So just start somewhere.
Yeah. I was even thinking, if you don't even have the time or the money to do that, there's lymphatic drainage movements that you can do that, Chinese medicine has shown us works really well. It's a few jumping jacks, a few arm swings and things like that you can do in your room or in your wherever, privacy of the home, and then go to work.
Yeah. Or get a standing desk or a walking desk.
She has a standing desk. She doesn't use it.
Thing is on the right side and it just keeps going up and down without me.
Yep, it does operate without consent and she has to fix it all the time. Yeah,
I do.
Yeah, that's what happens when you get a fancy desk.
That's right. So.
Well, is there anything that you want to leave our listeners with?
It's doable. You can do anything. Trust me, you can do anything. Okay. So just start somewhere. And if you need guidance, I'm available at Safe Harbor and Kristina's here as well. We have a whole team of people here who can also help you.
Yes. And you can leave your website information.
Yes. www.safeharbor.medicalportjeff.com.
You can also find her through our website, which is www.limitlessintegrativewellness.com. And you go under the Wellness Collective and you'll see all of our members under there and a direct booking link for each one. Thank you for joining us today. Thank you for coming in.
Thank you, Kristina. It was fun.
It was fun.